Hi everyone, Dr. Nemechek here. I want to touch on and just explain toe walking again and what's going on there. So as I've talked about over and over in different ways, in adults and kids, when we get injuries, neurological injuries to our brain, it affects how well we can pump blood into the brain. So you end up with low blood pressure in the brain. And what happens is that makes it hard for the oxygen to flow into your brain. So you have red blood cells, you breathe, you fill them up with oxygen. You got to push at the right pressure for that oxygen to flow in the brain. If that's suboptimal, the brain doesn't get enough oxygen, the brain doesn't work well. Focus, concentration can make you tired, cause anxiety, and the brain kind of panics. The brain doesn't like this. The brain thinks this lack of oxygen, it's kind of comparing it to like maybe you're drowning or something. And so the brain starts eliciting these signals to force you to do things. Now, here's my old pen, so that's your head. If you're having trouble pushing blood into your head, what happens most commonly is the blood will pool in your leg muscles, okay? And the brain learns, if we can get the body to move those leg muscles, constrict those leg muscles, what happens is it generates more pressure and the brain gets more oxygen, okay? And you see this in adults. They're sitting at the airport, some guy's looking on his phone and his leg is just going bop, 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 bop. Okay, his brain is forcing that to happen to generate pressure to offset the low pressure in the brain so he gets more oxygen. Now, children with autism, okay, have like zero impulse control, almost, and so this is intense hyperactivity with them. But the brain will do something else. It will cause the kids to stand on their tippy toes. And when you do that, if you just watch this, stand up wherever you are, stand on your tippy toes, and you will feel your leg muscles tighten all the way up to your hips. That tightening of muscles squirts blood upwards. Okay? That's what toe walking is. Toe walking is the brain trying to generate blood pressure. So it's an alternative to running and standing on your tippy toes. Okay? You can get a lot of pressure that way. It's not something congenital short tendons or something like that. Now I know they have gone with surgeons will go in and cut the tendons and lengthen them. Now if a child's been doing this their whole life and they're 18, they may have substantial contracture that maybe that's required. But when you address the problem, which is the neurological dysfunction, and you can get that to recover and the blood pressure improves, the toe walking goes away. It doesn't just go away overnight. You'll be noticing, like in using our protocol, you'll be noticing, oh, it's a little better. Hey, occasionally I notice he's flat. And then they're flat most of the time unless there's something kind of stressful going on. And stress will drop your pressure a little bit. So these old kind of behaviors, they'll get on their toes a little bit. But you'll see it just melt away. And I've seen that in kids who are teenagers who've had toe walking for a decade. I've seen it go away without the surgery. Okay, so will all kids get better without the surgery? I don't know, but I think it's well worth, if people are talking about doing that, I think it's well worth to try the protocol. Just get the inflammation down in the child and see as they're recovering if it just fixes itself without surgery. I don't think there's this major urgency to deal with that problem. So anyhow, pretty simple, slow blood pressure, just like a lot of other things. That's the cause of toe walking, and we can routinely reverse that using the protocol. Everybody, have a great day. Take care now.